Burks is an international leader in multiple sclerosis, neurology, and chronic disease management. For more than 30 years, he has been involved in comprehensive care, research, and education in MS. Dr. Burks is Chief Medical Officer of the Multiple Sclerosis Association of America, Cherry Hill, New Jersey, and President of Burks and Associates Healthcare and Education Consultants, Reno, Nevada. He is a member of the National Medical Advisory Board of the National MS Society. Dr. Burks has written and edited textbooks on MS management and research, including multiple sclerosis, diagnosis, medical management, and rehabilitation, and published numerous scientific articles and reviews. He is a medical and scientific consultant to many healthcare companies and has lectured to healthcare professionals, patients, and the public in over 40 countries on 6 continents. Dr. Burks.
Thank you very much, Jay. First of all, I have to take a minute and thank the MS Foundation for arranging such a marvelous experience, not only educationally, but a fun experience to get together. And so thank you, Alan, thank you, the staff. It's been a real pleasure for me, and everybody I've talked to has enjoyed it. So let's keep it up. Let's keep this. This is a great way to work with people with multiple sclerosis. Okay, I'm going to talk just briefly about complementary alternative medicine, but I'll be happy to answer questions. Some of the questions that I get is, how does it differ from traditional Western medicine? That's a question I get a lot. What are the problems with considering CAM? What are the warning signs of scams? Because there's a lot of scams in this business. How do you evaluate the placebo effect? And talk about specific CAMs that I think are helpful, ones I think you should avoid, and how do you make the decision? That's what we're going to do. First of all, complementary alternative medicine is very common. 42% of households, it's $27 billion a year. It's increasing dramatically. Everybody's taking supplements. Everybody's doing this. Everybody's doing the other things. It's for the most part, I think it's terrific. So how do you define it? Well, you define what it's not. It's not taught in medical schools. The doctors tend to be, they don't know much about it, and they tend to poo-poo it, although we're getting better, especially with the younger doctors. They don't need prescriptions, usually. They're not accepted by many MDs as having any value whatsoever. And that's because they're not database. We don't have the type of scientific study that we have with Jolinio, with Tecfidera, those sorts of things. That's what we expect, those studies. And those studies are hundreds of millions of dollars, and they're not being done. So we use experience for that. And the problem that doctors have is that, well, if you have a good experience, if you do something to have a good experience, you tell everybody how good it is. If you have an experience that's bad, you keep it to yourself. You don't want anybody to know you're so stupid to do that. So we don't consider that data-based. But I see them as therapies, in their best sense, therapies that balance the mind, the body, and their environment, and they do it harmoniously. One of the problems is there are a lot of CAM publications, and there are many inaccuracies. And like, for example, one of the things I hear a lot about, this is going to help your immune system. This is a drug from China that's going to help your immune system. So MS is an immunologic disease, and so we can help your immune system by taking this. Well, think about what they're talking about. They're talking about helping the immune system. Usually means that's increasing the immune system. Well, in MS, we think that the problem is you have an increased immune system. So I'm not sure I want my immune system increased anymore. So be careful when you say something that helps the immune system, what we're really talking about. Because if you look at most of the disease-modifying therapies I've talked about in this talk and the one before, they've tried to dampen the immune system without hurting people, without causing problems. So be careful about when you hear about something being so good, because it helps the immune system. And that I don't like the idea that people talk about cures for MS. I think that's probably not a good way to look at complementary alternative medicine. And I think the claims are very exaggerated. And the claims are usually come across with money, especially from the internet. 1995, I can do this for you and do that for you. And so we need information about the claims. But these are the pitfalls in thinking about complementary alternative medicine that I think. First of all, it's natural, so it must be better. Arsenic is natural. Is that better? Okay, it's natural, so it must be safe. More is better. I don't need to talk to my doctor. First of all, I won't listen to him. He'll make fun of me. He'll tell me not to do it, and so therefore I shouldn't talk to him about it. I think that's passé now. You really need to let your doctors know what you're taking. And I think people don't understand that many of these drugs have interactions with drugs that you're currently taking. And I think you need to have everybody understand what you're taking, so if there's a problem, they can help figure that out. And the other thing I've noticed with a lot of complementary and alternative herbs and stuff like that is people, it's this week they're doing something, and next week they're doing something else, and next week they're doing something else. So there's no consistency in this. So here are the warning signs for scams. The word miracle is a warning sign. The works for all major diseases, cancer, arthritis. It's that warning sign. It has secret ingredients. You have to stop your conventional therapy to get this. The proven FDA treatment should be stopped so you can get this. And they're promoted by testimonials, not actual data, not what happens to patients, but what happens to Mrs. Jones, who said she ran 100 yards yesterday out of her wheelchair with this, and without even knowing whether Mrs. Jones had MS or had an emotional problem, say, for example. They're expensive and they're complex, and people want their money up front. So the factors to consider. First of all, the placebo effect. If you look at the treatment trials for multiple sclerosis, they all have to have a comparative arm. And most of those are placebo. Well, guess what happens to those placebo patients? They do really well. So therefore, the ones that are approved by the FDA actually do better than placebo. Whoops, my subscription is, oh my goodness, I hate that when that happens. I think this is your computer. Can I just put OK? And so they'll get rid of it? Nope. Nope. Now we're going to cancel this. Okay, I got out of it. I canceled it. You don't need another one. Okay. The placebo effect is amazing. And you help people, you do that with encouragement, they're going to feel better. They're going to want to feel better because the doctor's trying so hard to help. But that's why we have this very elaborate scientific protocol to say, is it better than placebo? Because the placebo, I don't call it an effect. I call it a placebo response. We respond to placebos. There was a study, I think one of the first studies, that they gave people morphine after surgery and then they gave them placebo, told them it was morphine. People didn't have that much pain when they got placebo. So there is a mind-body connection. And when you hear people like Mindy talk about working on the mind-body connection, that's so important, whether it's yoga or Tai Chi or whatever else you want to do. So use it to your advantage. But be careful about paying lots of money and stopping your current medications because of it. Okay, I think the good complementary alternative medicines are things that, first of all, they're I consider them life enhancement. I consider helping their symptoms, and I think we need to look for specific treatment claims. So what are some of them? Traditional Chinese medicine, acupuncture, the meridian points, qigong, qi, things like that. I don't have time to talk about each of these because I wanted to get the other talk done as well. Homeopathy, naturopathy, and Mindy, are you up next?
After lunch.
Okay, after lunch. You can talk about some of these because you're probably much more familiar with many of these things than I am. But I try to deal with them as best I can. I think I wrote the first chapter ever on complementary alternative medicine back in the late 1990s because I was trying to figure out, what does all this mean? How can I help patients? But the life enhancement therapies that I really think are something to consider are yoga, Tai Chi, Reiki, Feldenkrais, massage therapy. I think it can be very helpful for people to get better in touch with the mind and body. Let's see. Meditation, biofeedback, visual imagery, spirituality, faith, prayer, hypnosis. All of those are worthwhile, in my opinion. And they cost almost nothing. and they help a lot of people. Yes, ma'am.
Can you tell us briefly what Feldenkrais is?
I'm gonna leave that to Mindy this afternoon. Mindy does that sort of mind-body sort of thing. I'd love to, and I want to try to get finished with this. Is that okay with you, if I pass that to you? Aromatherapy, I mean, do you talk about aromatherapy to a doctor? It's like talking to the wall. But you talk to patients who go through it, they'll say, I really feel better. Makes me feel better. And again, Mindy's going to talk about, hopefully, this in the future. We had Laura talked about dietary recommendations, and there is no diet that cures MS. But the things that I like to talk about are low saturated fats, high fiber, I think omega-3, multivitamins, and talk about going to a nutritionist at some time. If you're really having struggles, the nutritionist can be very helpful. These are the low toxicity, low cost, potentially beneficial. And I'm not going to go through these. You have a list. Some of them we've talked about already. And I'll just mention cooling. One of the things you got in your packet is a cooling apparatus. I think cooling can be very helpful. And I'm going to move on. I'm going to talk about exercise. I'm going to talk about exercise. I'm trying to think of anything better than exercise for all of us, especially people with multiple sclerosis. It helps the weakness, it helps the balance, it helps the stiffness, it helps the bone softening, it helps the pain, it helps the bladder and bowel, it helps the fatigue, and insomnia, depression, anxiety, and anger. And it's free. Okay? And Mindy probably has some thoughts about that too. Maybe she'll talk about that this afternoon as well, is the value of exercise. I'm not going to talk about this. I'll talk about removing dental amalgams, just because that's a hot topic in some places. There's no evidence to support that you have to have your dental amalgams removed because of the arsenic in them. And the guy who did that, who's in Colorado, actually lost his license over that. Here's some that have no convincing benefits. They're potentially toxic and or high cost. The aspartame avoidance, I don't see it. Dental amalgam removal we talked about. Bee venom, data's not there. These herbs that stimulate the immune system. There's a drug called Procarin, which pops its head up from now on, which is basically caffeine and histamine. Hyperbaric oxygen. I have a lot of people who swear by hyperbaric oxygen, and that's fine for them if they can afford it. So I don't think it hurts anybody. But I took a dive, hyperbaric oxygen dive, to see what it was like. And I was talking to the guy next to me when I got out, and I didn't feel any different. And I said, "How are you feeling?" He said, "It's great. It's the best thing that ever happened to me." He says, "I have Alzheimer's disease." And I said, "Oh, tell me about it." He said, "Well, I was in an automobile accident. My wife died. And I was so depressed. And I lost my memory. Now my memory's coming back." And I said, "Okay, maybe. That's what you hear about some of this stuff. Snake venom, not proven. These are all interesting. They have all interesting theories, but we haven't seen proving that. These are drugs that stimulate the immune system. This is for your reference. If you want to take one of these, check this list. These are from Alan Bowling. Alan Bowling is sort of the guru of complementary alternative medicine. I got these slides from him. And these are ones that either are potentially toxic or uninvestigated. I'm not going to go through them, except that you can have them for your references. I will spend the last couple of minutes talking about marijuana, because marijuana is a big issue. I have my own personal feelings about marijuana. I was in Denver, Colorado for most of my adult life, which was about an hour away from a place called Boulder, Colorado, which I think was the pot capital of the world. So many of my MS patients were smoking pot, and they felt great. So I'd ask them, I'd say, "Well, how do you know how much to take?" Well, if you get Maui Wowie, is it different than if you get the Idaho special? So, yeah, you have to know. And I can take 2 puffs, and I'm walking better. If I take 3 puffs, I'm so weak that I can't even get out the door. So I'm saying, we need to have more understanding of this. But I do think there's some data that helps pain. Whether it's placebo or not, I think it does. Spasticity, yes. And I'm absolutely opposed to it for MS. Why? So, I mean, I've seen people who feel better on it. And it's nice to, to go around feeling, oh, I feel good. Life is good. And I don't have the reference. Normally, when I do scientific pronouncements, I have references. But you'll have to forgive me, because this reference is from a very noted scientist. His name was Jerry Garcia of the Grateful Dead. And his quote is, "Pot makes you stupid." And he should know. The problem is, and there's some data to support this, is that cognitive issues for MS patients are real, in about half the patients. We don't want anything that reduces the cognition in MS patients. And marijuana is toxic to the brain in that way. And there's data now to suggest that it can decrease cognition. And why do I want to add cognitive problems to cognitive problems when I have other ways to treat spasticity? Yes, sir?
What do you think of Satinex?
But it's marijuana, basically. It's the active ingredient.
But double-blinded studies, I don't know how you double-blind something that
Yeah.
has marijuana, but
I think that those studies are reasonable pilot studies. I do think that. And I said before, I think they may help spasticity and they may help pain, but they didn't study cognition. You know, I need somebody to tell me it doesn't make you stupid before I think MS patients should put another toxin in their brain. And until these people who make Sativex and other drugs really convince me that it doesn't have long-term cognitive issues with people with multiple sclerosis who already might have cognitive issues, I think that the reason that people don't function very well with MS is not because they're in a wheelchair, in my opinion. It's because they're fatigued and they have cognitive problems. And so therefore I don't want to do anything to hurt cognitive problems. I got other treatments for spasticity that work pretty well. But again, what I say is that, whoops. Anyway, for some reason I got screwed up. But I'm going to just tell you how I approach. Last couple of slides are missing from mine. I don't think they're missing from yours. I think they're just missing from mine. Here's my approach, and I actually wrote them down, and they're in your handout. First of all, when you talk about complementary alternative medicine, do a few things. First of all, where'd you get the source? Write it down. Put down the data, as much data as you can before you come to see me. And I review the data, and I talk about the pros and cons. And I try to differentiate between symptom management and cures for the disease, because they're really different. And you need to understand, well, this may be a symptom of spasticity for MS, but it may not be the cure for MS, as long as you know that. And then we discuss the risk and the cost. So here's my approach. This is my last slide. I explain to patients about the need for scientific data, the pitfalls. I try to compare the treatment of, like, marijuana with baclofen and other anti-spasticity medicines that we use, for example. I discuss the interactions of the complementary alternative medicine that the patient wants to talk about with other medications that they're taking, so they'll know what the risks are of trying to mix these medications. And then I always express my opinion. Okay? I tell them what I think, and often I'll say, yeah, I think that sounds reasonable. You know, especially if it's one of the things that I really think is low cost, low toxicity. And then I tell them, what you do is your decision. And I'll talk about that in my next talk, my last talk, is shared decision making. I'm your advisor. I'll try to give you the data that I know, but I respect your right to make your own decisions. And no matter what happens, if you try this, I'll still be your doctor. I'll still be with you forever and ever, as long as I can be around to be with you. Doesn't matter what you do, I'm going to remain your resource. And I think that's the way to look at complementary alternative medicine. Thank you.
Thank you, Dr.